Hi, I am J. Riaz Khan. This is Paramedical Students. Today we have learned in this video the most commonly used one of that muscle relaxant. That name is Atracurium. So Atracurium is comes in a pill have 2.5 ml. Each ml contain 10 microgram in 2.5 ml active. So in this video, we will learn about the whole pharmacology about the Atracurium. Let's deep dive into that concept and let's relax with the Atracurium. First, we learn the classification. Okay, Atracurium is comes up under we already know it is a non-depolarizing muscle relaxant. In previous video, we learned about the mechanism of action of non-depolarizing muscle relaxant. Under the non-depolarizing muscle relaxant, it, based upon the chemical structure, it's under benzoisoquinone compound. Okay, non-depolarizing muscle relaxant. According to the chemical structure, they divided into two types. One steroid compound and another one is benzyl isoquinol compound. The Atracurium is comes under benzyl isoquinol compound. And according to the duration of action, it intermediate to acting muscle relaxant. In muscle relaxant, act 10 to 5 to 10 minutes. Muscle relaxing act 5 to 10 minutes. It's a short duration action. Drugs, for example, Nevacurium, 10 to 15 minutes. It's an intermediate acting drug. Example, Atracurium and Victorium. Most of the drugs comes under this. And more than 50 minutes, it's a long acting muscle relaxing. That is a classification of muscle relaxation based upon the duration of action. Okay. Now, muscle relaxation. It's example spine curving. Okay. According to this classification, Atracurium under intermediate acting Tamil acting muscle relaxants. Okay. Then we learn the chemical structure. Okay. It is the highly ionized compound. Okay. Highly ionized and water soluble. Due to its ionized and water soluble property, it does not cause blood brain barrier. So, no CNS effect. And pleasant also. So, no placental effect also. So, no placental effect also. Okay. We know this common rule about the drugs. If the drugs want to cause membrane barrier and placenta like the membrane, it should have three properties. Okay. Uh, drug properties. Properties to cross EVB like this. Okay. The properties to cross between like things. So three property. One, lipid soluble. Another one is non-ionized. And third is small in size. Okay, these three properties we helps to cause the membrane barrier like the thicks. Okay, to compare this property, Atracurium it's a highly ionized compound and water soluble, not lipid soluble. So it does not cross the blood. ring barrier, so no CNS vector part. So due to its chemical structures, its cross is what like this condition. Okay. Then we will learn about the mechanism of action. We already know about the previous video in mechanism of action. Um, it is a competitive antagonist. It's act on the nicotinic anticholinergic nicotic and acetylcholic receptors and blocks the communication between the nerve and the muscle, so the muscle become a relaxation. That kind of mechanism action is followed. The Atracurium, not only Atracurium, hard non-depolarizing muscle relaxers follow this kind of mechanism of action. That is a heat based or do nothing. Now we'll learn about the pharmacokinetics of the Atracurium. Pharmacokinetics. In pharmacokinetics, we will learn about the four parameter. One, onset. The onset of Atracurium is around 3 to 5 minutes. And second, duration of action. It's 20 to 35 minutes. So it's intermediate acting drug. We already know that. And third one is protein binding. Around 80% of drug binds in protein, plasma protein. Okay. And fourth parameter is volume of distribution. Is 0.16 feet per kg. Okay. So we know that the onset and duration. The onset is nothing but how long to take get action. That is called onset. And duration is how long it will be acting. The drug will be acting. It's called uh, duration of action. We already know that. What is the protein binding or volume of distribution? In this video, we will learn about this thing also. Okay. So protein binding. Protein binding is nothing but that some amount of drug after gives birth drug, the some amount of drugs is bind with the plasma protein. Okay. It's a drug and it's a plasma protein, especially alpha B. And some drugs are free. Okay. It's a free drugs and this bound with the protein. Okay. So two forms of is there. One is bonds with protein. Another one is free drug. The bonds with protein drugs is a inactive. It's not make any action. Okay. It's act like a reservoir only. It's act like a reservoir only. And the free drug, it is the active one. So these are the active drugs. It's a reservoir only. It's inactive. Okay. And after giving the drug, the free drugs is bind with a receptor. Binds receptor to get action and metabolism and excrete. Okay. The pre-drug is active binding bind with the receptor and get action and metabolism and excreted. After execution of the pre-drug, the bonds with the protein drugs is released the drug, then it will become free, then it binds the receptor and get action and metabolism and excreted. And this continues. After it's excreted, it release the drug. Okay, so drug we release and act on the receptor and excrete metabolist and excrete. This is the concept of protein binding. In Atracurium, 80% of drug is bound to the protein. Okay, in initially the 80% of the drug bound to the protein, only 20% is free. That 20% act on the acetylcholic stake coding receptors and make the action and metabolism and excreted. Okay. After completely 20%, the 80% of drug is gradually released from the plasma protein. So this is the protein binding function. So how it significates? It significates in three types. Okay. What is the importance of the protein binding in this pharmacology? It determines effect of drug. Okay. The more number of plasma protein binding drugs have less effect because there is no free thread. The free threads is the active one and that will bind the receptor and a metabolism excretor. So more number of plasma protein bound threads is a less effective one. And duration of action. It determines the duration of action. To determine the duration of action, it is a one of the factor. Okay. And more number of protein binding drugs is increases, the duration of action also increases. Okay, duration of action also increases. How the drugs bonds with the plasma protein, it's gradually released, so it takes time. So duration also increases. And third condition, decreased albumin, hypoalbuminemia. Decreased albumin in the blood. The normal albumin value is 3.5 to 5 gram per deciliter. Less than 3.5 gram per deciliter in some condition, liver disease, nephritic syndrome, and burns, etc. And this condition, the albumin level is low. So protein bonding is less. Okay, in this condition, the bonds to the protein in the drug is less. So effect will down and duration of action also. Sorry, effect will high because the lot of it is available there. The because of albumin is very less in the lead and effect is high and duration of is. So these three conditions will more understand about the protein binding concept of pharmacokinetics. We will learn about the volume of distribution. Okay. Volume of distribution is nothing but how drug spreads into the tissue. Okay, the distribution of the drugs from blood into tissue. Okay, in this concept there is a two condition: increased volume of distribution and decreased volume of distribution. Okay, increased volume of distribution it denotes drugs spreads all tissue. Decreased volume of distribution is denoting the drugs stay in the blood. Okay, that is a concept of volume of distribution. So how can I classify the drugs having an increased volume of distribution and decreased volume of distribution? That is helps an extracellular volume. That is 0.2 electron per kg. This is extracellular volume of our body. If the drugs volume of distribution value is more than ECF value, that is 0.2 liter per kg, that is called increased volume of distribution. That means the drug spreads all over the tissue. If the volume of distribution is less than ECF value, that is 0.2 liter per kg, it is the increased volume of distribution. In Atracurium, it have a 0.16 liter per kg. It is a less than ECF value, that is 0.2 liter per kg. So it is a decreased volume of distribution. So it's mostly stays in the blood only. That is a concept of volume of distribution. That volume of distribution helps to find the loading dose and off life and and dry clearance also. Okay, this is the pharmacokinetics of the Atracurium. So now we learn about the metabolism and elimination of the Atracurium. Unlike other drugs, Atracurium have a unique property of metabolism and elimination. It is a independent metabolic metabolism metabolism process. It does not different liver or kidney for metabolism and elimination. It doesn't need to liver and kidney for metabolism and expansion. Okay, because it have a unique metabolic process. Two type of metabolic processes. One is Hoffman elimination. Another one is Ester Hydrolysis. Hoffman elimination is nothing but it elimination and metabolism and elimination in non-enzymatic way of metabolism. Even it doesn't have a liver activity for elimination, but it depends physiological pH and normothermia, that is normal temperature. If the patient have normal physiological pH value and normal temperature, the non-enzymatic way of metabolism of atracurium is happen. The another one is Ester hydrolysis. The second way of metabolism is Ester hydrolysis. It is a chemical reaction between the atracurium and the water. Okay, so atracurium have a drug ester bond in chemical structure. It react with water. It gives water is divided into H plus OH. Okay, so drug plus OH and drug COH we will get OH, that is acid, and drug plus OH, that is alcohol. We will learn in the 12th standard organic chemistry. Okay, that is an extra metabolism. This type of chemical reactions happen in this metabolism, so it doesn't lead liver and kidney for metabolism and elimination. That is a unique way of metabolism is happened in Atracurium. So next we learn about the other properties of Atracurium. Atracurium have an active metabolite. It's named Ladinose. The Atracurium itself, it doesn't not cross blood brain, but the Ladinose cross the brain barrier and makes seizure. But it's rarely happen. Okay, not significant, significant. And the Atracurium release histamine. Okay, this histamine, it's a bad guy. It's produced hypotension in tachy, flushing, and sometimes bronchospasm also. It's a rare thing, man. Bronchospasm. Okay. So when cautious with large dose of Atracurium and large dose of Atracurium and uh, raggedy eye cautious. When give a Atracurium large dose or rapidly, it's a chance for histamine release of high to get the kind of complications is the and effect of organ system. In CPS, it's hypotension and cardiac spreads. In CNS, no CNS effect because it's not caused by blood brain barrier, but Ladinosin do its sick. In respiratory system, it relaxes the muscles backward naturally give a caregiver, relax the respiratory muscles. Right your for mechanical location. And we'll learn about the dosage. The loading dose of Atracurium is 0.4 to 0.5 milligram per kg and the maintenance dose is 0.1 mg per kg and the infusion dose is 5 to 10 microgram per kg per minute. So how to prevent the Atracurium? So Atracurium is reversed using neostigma. It's combined with glycopyrrolate or atropine. This is anticholinergic drugs to reduce the complication of the neostigma, especially in radically. Okay, so neostigma this device it is a anticholine stress stacholine estrase. In previous video, we learned about the mechanism of action of the neostigma also. Okay, so this is the property of Atracurium. So hope we will learn about the Atracurium in this video. And the perk we will learn about the cis Atracurium also. Okay. What is cis Atracurium? Atracurium have a brother. Its name is cis Atracurium. In cystac, how different it's from Atracurium? It is a stereoisomer. Okay. In chemical, it's a stereoisomer. That means Atracurium and cisatracurium have a same molecular formula, same sector formula. But in 3D sector, the chemical bond is different. That is called stereoisomer. For example, the two hands there. It also three fingers. It's also three fingers, but it's not overlapping. So somewhere the difference that kind of differences happen in the between the cisatracurium and normal atracurium. Compared to Atracurium, clean kidney leads less produce less amount of Elimination and histamine release. So comparatively safer to use as Atracurium. So it's a good brother of Atracurium is Atrac. Hope we in this video we will learn about the beautiful duck Atracurium. We will meet the another video as soon as possible. And this is any of the areas. This is Paramedical Students.